Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, the topic is why it's so hard to be a health official during the pandemic. Dr. Sharfstein speaks to Dr. Jay Varma, a professor at Weill Cornell Medical School, who advised New York Mayor Bill de Blasio on COVID-19. Let's listen.
Dr. Varma, thank you so much for coming back to Public Health on Call. I want to ask you a question. Why is being a public health director such a hard job? And before you answer, I just want to say it's been pretty clear, I think, in the last few weeks, at the national level, at the state level, it is enormously complicated to manage through this pandemic. And I'm trying to understand why.
Yeah, thank you very much, Josh, for having me. I think, there have been appropriately a lot of, good publicity raised about how difficult it is to be a public health leader because of the political environment that we're in, because of, protests and really large-scale public disagreement about levels of risk tolerance. But I think there's some other issues that maybe haven't been addressed quite as much. I worked with some of my other colleagues who led the response here in New York City to write an essay about kind of leadership challenges. And there are some ones that I think that are really unique and important for public health officials that are different than being a leader of other organizations.
I mean, even under the best circumstances, meaning, you have enough time to do your job, you have a supportive boss. This has been an enormous challenge.
Yeah, let's talk about some of the ones that I think are most uniquely difficult. I think the first one is about translating complex scientific information quickly and clearly to the public. The leaders of most public safety agencies, whether you're the head of the police department or the fire department, they're expected to be good managers and good spokespersons for their organizations. But they're not necessarily expected to be the complete expert on everything related to criminal justice or everything related to something flammable. Public health officials, however, are expected to be the top doctor who knows anything and everything about health. And that is even more challenging during a public health emergency where, the volume and velocity of information is changing rapidly. You suddenly have to be an expert on molecular biology and the evolution of new virus variants and what that means. You have to be an expert on therapeutics. You have to be an expert on the social science of how you build acceptance of public information. So I think one of the most complex challenges that a public health leader faces, that others face, is that ability to be a content area expert, as well as just a really good manager and a really good communicator.
Yeah, that's a lot to put in a job description.
Correct. And it's also a job description or a job sort of set of skills that, we who train in medicine or public health are not necessarily uniquely trained to do. Like a lot of us are trained in, how to evaluate evidence with a high level of rigor. But we're not necessarily also trained in some of the other aspects that come along with that, which is how do you evaluate that really quickly and explain it as succinctly as possible to a public audience. Now, it would be ideal if a lot of times you could say, well, here are my content area experts, let me bring them forward. But one of the lessons that I learned was that, especially when you're communicating internally and trying to build consensus, whether it's among the mayor or deputy mayors or other elected officials, they expect you to be the expert. Like they're leaning on you for your best judgment. And when you say, well, my staff think this is the best thing to do, you lose some credibility, quite honestly. And that's one of the lessons that I certainly learned, was that it was important for me not just to say that, well, the experts have read that study and conclude this. It was important to say, I actually read that study and this is what I think. And the experts agree with me. And so that being able to say that and be honest about that is difficult because you're trying to fit that into, a million other managerial tasks that you have in any given day.
Got it. Well, let's talk about some of those other tasks? What else makes this job very tough?
I think, another big issue that I think really needs to be, talked about and trained about better is when it comes to public communication, speaking both publicly to a large audience, but also even internally to decision makers, really being able to articulate clearly all of the factors that went into your decision. Public health officials, again, as we've said, are very good at evaluating evidence. But what they're not always so crystal clear on is how they communicate, how they went from scientific evidence to a decision. We just saw recently that there was a lot of, fury in the sort of scientific and public health community about CDC changing the guidance on how long COVID patients need to be isolated for. And even though there is a very legitimate debate about what is the right cutoff, I think one of the challenges CDC faced was it didn't communicate very transparently how it factored in feasibility, acceptability, harms and benefits, and wasn't very transparent about all of those factors that went into it. And so I think as public health officials, we feel very comfortable when we say, this is what the science says, but we become a little less comfortable when it comes to admitting all of the ways in which we had to you maybe shift a little bit away from directly the science to something else. So that's another, I think, critical challenge is learning to communicate clearly and with empathy in all the ways we know, but also to be very transparent about the factors that led you to make a decision, some of which may not be based on scientific evidence.
And could you give an example of what those might be?
Yeah, I think a very perfect example is, when we're talking about, schools all the time. In an ideal world, for example, you would want to test as frequently as possible. For example, we see that discussion and debate going on right now. A lot of school districts are either closing or there's a lot of protests going on because they're saying, well, you're not testing enough. That's a perfect example of a place in which, as a public health leader, you want to communicate about the value and importance of testing. But you also need to be honest that trying to test students every day or faculty every day in a large public setting is not something that is always entirely feasible. And you are always making a trade-off between what is feasible and what are the harms. And so one of the harms, for example, is, when you talk about rapid tests, well, rapid tests are more rapid than a PCR, but if you're trying to test 30 kids, it still takes a lot of time. So that's kind of an example from our experience of where, we had to make decisions where the science would say, do as much as you possibly can. But the real world says you have to balance that with all sorts of other feasibility and harms that might occur when you implement.
And having people appreciate those different factors is very challenging.
Well, I think this is where really one of the big challenges comes in, right? A lot of us, when we're in public health leader positions, we can't, just as I'm advocating that we communicate more transparently, we're also under under certain handcuffs sometimes because, we know that there are lots of reporters and other elected people who want to get you. And so that is where I think one of the tension arises. You're sometimes a little hamstring in your ability to communicate that clearly because you also have to be aware of the political context that you're working in.
So another degree of difficulty. What about the challenge that public health officials face to think big enough about the challenges and really demand support from other agencies, other sectors to address a urgent health issue?
Yeah, this was one of the lessons that I learned in my public health career early on, working on, tuberculosis and HIV in the developing world. One of the big important innovations was really the movement of patients themselves, people living with HIV, to advocate and say, look, you can't make a recommendation for, say, HIV medications in Africa based on a supply constraint. It has to be based on what is the best thing for humanity. So a lot of times I think public health officials, they get into a scarcity mindset. We in public health are used to knowing that we may only have $1 to do something, so we only ask for $1. But when it comes to emergencies, particularly some as grave as this, and similar to the HIV crisis, it's important for public health officials to start from a premise that if I had unlimited resources, what is the right thing to do? And then to use that to work your way backward to, well, what do I have the resources for right now? and make your plan based on that, but also make a plan for not just what I'm going to do with the resources I have now, but how am I going to try to get those additional resources to do the ideal possible? We faced this challenge in New York. When I first got to New York in early April of 2020, when I was sort of called to see if I could help, and I had been based in Africa, I was really struck by a place like New York, which has the largest, most, well-established health department in the country and tremendous resources and political commitment, hadn't really made a massive investment yet or plan even to build a widespread testing ability. And part of it was that there was a sense, I think, a real sense of being overwhelmed and this idea, we're never going to have enough PCR reagents. And I think one of the challenges is they almost needed an outsider like me, not because I was, particularly brilliant or anything, but they almost needed an outside, voice to be able to say, well, look, we actually can do this. We're not as overwhelmed as we think we are. We can, make progress incrementally. And, within a few months, we had built the capacity, really the largest testing capacity, I think, of any major municipal or state in the country. And even now we're seeing that's not even quite big enough. So, I thought that we thought really big, but, maybe we didn't even think big enough as much as we had to.
Right. Well, you're talking about a fundamentally political skill, which isn't typically taught in public health school or medical school, for example, which is knowing how and when to make pretty big requests, or at least tell people that they're not going to solve a problem unless they really invest a lot of resources.
There's a unique amount of, there's this unique skill, which, I and some of my colleagues have talked about before, this kind of like bureaucratic magic, like this ability to think about how in the public health world you can work with your other partners in other government agencies to make the big ask. Some of that is about asking for the resources yourself. But the other skill that public health officials need to know is how you can partner with other agencies. So, for example, in New York, when building out the vaccine strategy, a lot of people in the health agency felt that we can just lean on the plans that were used, say, during H1N1, which was really driven by just the health department. But it became immediately obvious, both to my colleague who was the health commissioner and my other colleagues working in other health-related agencies, that we needed to make an all-of-government ask. You cannot vaccinate 8 million plus people without pulling resources from across government. And I think that's the other challenge that public health officials face, is not just the ability to think big about the technical and resource needs, but to think about who are the other agencies I can partner with. Because if you walk into an executive's office hand in hand with the commissioners of other agencies, your request is more likely to be honored than it would be if you're making it only for your agency alone.
Yeah, I would take that to the next step, using Baltimore as an example, where frankly, the city government alone was not going to be sufficient for the task. And it led to the health department and the health commissioner leading a major public-private coalition that Johns Hopkins was a big part of, the University of Maryland, some of the Care First, the leading insurer. And that really created the potential to expand access to testing, treatment, and other types of services for people who are isolating and quarantining. And it was not a usual kind of request to turn to the private sector and say, we are going to need your help to be able to save people in the city.
No, that's a great example. Yeah, I think it would be really interesting to think about, how that worked in some areas versus others. It's sort of an interesting combination of vision and humility, right? Vision, humility, and political savvy. The vision to say that we need this, the humility to say that we as an agency can't do it alone, even though it's something that we would like to be able to do. And then, of course, the political savvy, of course, of knowing how you can pull in the partners that have the influence and the resources to actually join you.
Yeah, I think Dr. Jaraza, who's the health commissioner in Baltimore, has managed to do all three of those things, but it has really been incredibly challenging for many health officials around the country. So maybe let's go for one more. I think our goal here is not to dissuade people from becoming public health officials. Would you agree with me, Dr. Verma?
Oh, absolutely. I think public health, as you know, being a leader of a public health agency is one of the honors of a lifetime. The ability that an executive and your population entrust in you. So no, absolutely, we want to encourage people to do this. I would say an interesting aspect and challenge also, sort of closing one I would say is that, when you learn to become a public health leader, you kind of also need to learn how to be a lawyer at the same time, which is always interesting because I think a lot of us specifically went into science and public health because we weren't interested in a lot of our classmates. Maybe you also wanted to be lawyers. But as we know, when you work in public health, law has the ability to enable, to frame, to enforce, to really enable public health to work effectively. And particularly during an emergency, you have to work hand in hand with lawyers to understand, what does the law enable me to do? And are there certain situations in which I have the ability to influence or change the law to do what I want? We faced that challenge quite a number of times. I had to serve as the, sort of expert affidavit writer of witness for the city when it came to lawsuits challenging our ability to do testing in schools, lawsuits saying that we weren't doing enough testing in schools, lawsuits when it came to restricting business activities, whether it was indoor fitness classes or restrictions and closures in certain geographic areas. So learning how to think like a lawyer and to understand, why public health decisions can't be case by case, understanding that you need to have a consistent rationale that can be carried forth and that is also consistent with the law is critically important and a skill that I think all public health leaders need to learn.
Yeah, early on in my training, I audited a class in administrative law, which turned out to be incredibly helpful to me.
Oftentimes, I've worked in different public health agencies around the world where some lawyers are very much along the lines of, you can't do this unless it's specifically authorized your authority to do it. Whereas other lawyers can read the law and say, well, look, you're not prohibited from doing this, and it is consistent with the intent of other aspects. So your ability to become familiar, as you did taking that administrative law class with the law, helps you be on both sides of that discussion. When you know that you're really constrained and when you know you're on firm enough ground to actually challenge the advice that you're getting and do things that are in the interests of improving people's health.
Well, it sounds like one of the takeaways from this pandemic is that we have to broaden the concept of training public health leaders to be able to do some of the things that you're talking about.
Yeah, absolutely. I mean, I think this is the first time that I think a lot of average Americans actually have any idea what an epidemiologist is or what they do. But what we really need to do is now make sure epidemiologists and physicians who are interested in leadership positions also understand that their ability to lead is far more than just being, excellent in certain areas, certain content areas that they're used to. It's broadening their understanding of what it takes to be a leader, and not just a general leader, because you can get leadership training in business schools or anything else, but the skills that are really unique to public health leadership.
And in the meantime, maybe those of us who are not right now public health leaders could express a little bit of understanding for those people in those very difficult jobs.
Oh, absolutely. I think this is a challenge we all face. It is really easy now that I'm in an academic position to second guess my colleagues. And I have to think back and remember, wait, I know always what I was thinking when I heard that from somebody else is, you have no idea how hard my job is. And so, we always have to have a lot of empathy and assume the best. Assume that people are really trying to do the best they possibly can. Question them where necessary, but also have a little bit of understanding of the constraints that people are operating under.
I think that is a great point, a great note to end on. Thank you so much, Dr. Varma, for joining me again.
Great. Thank you very much, Josh. I appreciate it.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Niall Owen McClusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.